Good evening. It's a great pleasure to welcome you today as we gather for this momentous celebration to break ground for the construction of Imperial College's new School of Public Health building at the White City campus. In other circumstances, of course, we would have invited you to the construction site itself. Although that has not been possible this year, I hope that this evening's presentations will convey something of our vision for public health research and give you a tangible sense of the new building and the opportunities for collaboration that it unlocks. This evening's event provides an opportunity to look back as well as to look ahead to the future and the challenges it brings. Great new directions in academia don't happen without strong leadership. I want to thank a few such leaders. I distinctly remember on one of my very first days at Imperial, Professor Elio Riboli coming into my office. He was the director of the School of Public Health, and his persuasive appeal about the importance of public health was convincing. Add to that our current director, Professor Deborah Ashby's tenacity, and both of their leadership, along with the support of our dean, Jonathan Weber, has brought us to where we are today. Today's celebration is a milestone in the campaign for the School of Public Health, launched a little under 3 years ago with the aim of raising £100 million. At that launch, we made the compelling case for the importance of public health, and we pledged to develop new paradigms for public health focused on the community. We couldn't have known then how the coronavirus pandemic would cause each and every one of us to value public health, personally and collectively. In a few moments, we will hear from Deborah on some of the highlights of that campaign and the profound impact that philanthropy has already had on public health research at Imperial. I would like to thank, on behalf of all of us, those who have given so generously. In particular, we are grateful for the vision and support of Merritt Moan, Community Jamil, Humphrey Badcock, and the Houston family. The moment of breaking the ground itself is captured in a short video presentation by Professor Neil Alford, who leads our estate strategy and planning for the White City campus. This video will provide a sense of the scale of the ambition for the building, as well as a preview of its final shape and location in the White City campus. Later, we have an opportunity to hear directly from Professors Neil Ferguson, Frank Kelly, Mireille Toledano, and Robin Norton, who join us for a panel discussion. There will be an opportunity for guests to ask questions of my colleagues, and I will invite you to join in and submit questions. When we launched the campaign for the School of Public Health in June 2018 at the Foundling Museum in Brunswick Square, central London, we created a film setting out our vision. I would like to share an updated version of that piece with you now.
In public health, we try to deal with some of the big problems.
Historically, that's been infectious diseases, and that's still an urgent priority in much of the world. And it's about preventing the diseases which cause most mortality and sickness in our lives.
It's all about obesity, it's about diabetes, it's about mental health.
In the UK in particular, though increasingly we're concerned about chronic diseases, diseases of ageing.
I'd say there's nothing more important than the health of people, the health of children, the health of adults. In public health, what we're trying to do is to make sure that people live healthy lives for as long as possible.
A lot of the problems we deal with in public health are multifaceted. and the only way to understand them and solve them is by actually having people from entirely different disciplines being close together to solve the problem in their entirety.
At the moment, we're spread across various campuses.
And I see for both staff and students having that possibility of more informal interaction will probably be the greatest strength of having us all in one place.
So it's really timely to build the new foundation for building for the School of Public Health at White City.
It is such a rewarding place to be because you can make changes and that has huge impacts on individual patients.
I see White City as an ecosystem, if you like, which is going to bring our science, Imperial science, into the population.
And I think it's important we reconnect with not just our global constituency in public health, but actually with the communities in this country who have desperate need of improved population health.
This is not a 5 or a 10-year project. What this is investment for the next generation, and for that we need the new generation of leaders, and if we've done that, then I shall be very proud.
For the School of Public Health, there is a massive opportunity for philanthropy to make the biggest difference to the health of not of individuals, but of whole communities, and actually globally.
Imperial is the place that pound by pound, person by person, will actually deliver more science than any other place that can improve the health of lots of people and create a better world for lots of people.
To help people be as healthy as they can be for as long as they can be, we need investment. There is no better investment that you can make than in the health of the future populations.
Good evening. I'm Deborah Ashby and I am the Director of the School of Public Health. Since we launched the campaign for the School of Public Health, more than £57 million has been donated in support of the facilities, the lab infrastructure and academic posts needed to advance a programme of research in world health, children's health, community health and policy, and lifelong health. The incredible generosity of our friends and supporters, many of whom I know have been able to join us today, has already had an impact. With support from Marit Mohn, an Imperial alumna, we have established the Mohn Centre for Children's Health and Wellbeing under the direction of Professor Mireille Toledano, who is bringing new strategic direction to our work on children's health. We are grateful too in this area for the generous support of the Houston family, who have given so generously in support of children's health. Their gift is creating a new senior academic post to secure leadership in this priority research area. With Community Jameel, we co-founded the Abdul Latif Jameel Institute for Disease and Emergency Analytics, headed by Professor Neil Ferguson, which applies data analytics and epidemiology to combat disease threats worldwide, from COVID-19, malaria and HIV, through to diabetes and heart disease. The philanthropic support of Humphrey Babcock enabled us to appoint Professor Frank Kelly, who is one of the world's leading researchers in air pollution, and he's the first Babcock Chair in Community Health and Policy. Frank has joined us from King's College and brought with him more than 65 colleagues working in the field, helping to make Imperial one of the largest clusters of expertise in air pollution and health. To all those who've donated, including those who've given anonymously to create a data visualization suite for Professor Kelly's team, we are incredibly grateful. We are fortunate to have Murray, Frank and Neil with us this afternoon, and they will be able to tell you more about their work and the difference that your support has made. These developments are hugely exciting. Each represents an opportunity to think in new ways about our research and to forge new collaborations across existing groupings. And this is the wonderful impact of philanthropy, enabling us to do things differently, to take on new challenges that will be difficult to find funding for from conventional sources. We are hugely grateful to all those who've given to support our vision for public health. 3 years ago, as we announced the launch of the campaign, we could not have known that the world would soon face one of the greatest global crises for a generation. Researchers in the School of Public Health have been absolutely at the forefront of the global effort to bring this pandemic under control. Many of you will have heard about the report published by Professor Neil Ferguson and his team, which provided evidence that helped to shift the UK's early response to the pandemic. Neil will share more about this later on this evening. Many other researchers are involved too. We are providing intelligence on the spread of the virus and the success of control measures through the REACT study, which each month tests thousands of people using home tests, providing vital insight into the pandemic and its progression. Other research is looking at how the lockdown has affected the mental health of children and young people. I am incredibly proud of the contribution that the School of Public Health has made in the fight for better health for all. The pandemic brings that into sharp relief, but our ability to respond so quickly and with such impact is a result of our existing strengths in epidemiology, data analytics, primary care, policy development, and community health and public engagement that we've honed over many years in the fight against more established health threats, such as malaria, HIV, and Ebola, as well as the non-communicable diseases like diabetes or dementia. At the White City campus, we have an opportunity to take these achievements to a new level. Here, for the first time, our staff will be based at one shared location. Bringing this huge range of expertise into one single location is just so exciting. It makes possible new connections, new collaborations, makes it easier to share ideas and solutions. I'm very excited to see what the future is going to hold for us. The film that we're about to view together gives us a glimpse of that future. Beginning with the White City campus as it is today, and the moment when ground was broken on the construction site, the film looks ahead to the completion of the new School of Public Health building. I hope that you will find this preview as inspiring as I do.
Welcome to Imperial's White City campus. The White City campus is Imperial's new campus in London, bringing together world-class researchers, businesses and partners from academia to work and share ideas to produce cutting-edge research for benefits to society. Currently at the White City campus, we already have the invention rooms on the south site, as well as Scale Space, which is a new community for businesses looking to scale. And on the north side, we have the Sir Michael Uren Hub, home to multidisciplinary biomedical engineering research facilities. We've got the Molecular Sciences Research Hub, which is the new chemistry home for research. We've got the Innovation Hub, where we convert ideas into businesses And we also have the grad pad, which is our home for postgraduate students. It's here at the north site that we're creating a new home for the School of Public Health. White City is one of London's most disadvantaged areas, with far worse health outcomes than the rest of London. Imperial has already established very, very good relationships with the local community, and it's with the local community that we want to see if we can convert our research and ideas into benefits. So we want to involve the local people in the research that really matters to them, for example, air pollution or mental health, and to help and support younger families. We're here today for the official groundbreaking of the School of Public Health. This is a fantastically exciting moment. We're going to see the project now come to life. The design stage of this particular project has been extremely interesting. We've been working very closely with our colleagues in the School of Public Health to design precisely what goes into the building. So there are teaching spaces, there are bookable spaces, there are research spaces, and of course, state-of-the-art digital studios, which we're going to need more and more in the future. Of course, our vision for the School of Public Health is a great deal more than just bricks and mortar. The School of Public Health at the moment is dispersed over a number of sites all over London. This project will bring them all together under the same roof. That's enormously exciting for both the School of Public Health and for the research that will be enabled by that. We're going to see researchers working alongside each other, researchers from completely different fields. And the point about that, it's at these interfaces of science, of different science, where the real new invention and new ideas emerge. We began this project in earnest in 2017, where we put the design team together in 2018. The groundbreaking is 2021, and the topping out will be in 2022, and we hope to move in 2023. Being involved in the School of Public Health project and working with a team of really professional builders, architects and so forth has been an enormous privilege for me. The more so because of the enormous influence that philanthropy has had on this particular project. As we prepare to work on the building's foundations, I hope you'll join me in thanking the people who have been so generous in giving towards this project.
It is my pleasure to join my colleagues in a brief discussion of their work in public health. I encourage you to put your questions in the chat. Let me introduce our panel. Professor Neil Ferguson is the director of the Jameel Institute. He is a renowned epidemiologist and leads a large group and is the principal author of some of the most influential reports on controlling the COVID-19 pandemic in the UK. Professor Mireille Toledano is the director of the Mohn Center for Children's Health and Wellbeing and an acclaimed expert in environmental effects on health. She is leading the largest study in the world investigating the influence of wireless technology on children's mental health and development. Professor Frank Kelly is the Badcock Chair in Community Health and Policy in the UK and one of the world's leading air pollution scientists. He leads a large group covering aspects of air pollution from toxicology to science policy. And Professor Robin Norton is Chair of Global Health and co-founder and principal director of the George Institute for Global Health, an internationally respected expert on injuries, chronic disease, and women's health. We are pleased that the George Institute has launched a new collaboration with Imperial in 2020. So Neil, let me start with you. When we launched the Jameel Institute, we talked about disease X. That quickly became COVID-19, so let's start there. On January 17th, 2020, you and your team evaluated early data from China and 2 other countries And you sounded the alarm on human-to-human transmission with report number 1. Your reports have alarmed, guided, reassured, and helped us and people all over the world. You're now up to report 43. What has this pandemic taught us, and how do you look at the future given those lessons from the past 15 months?
I suppose I might say facetiously at first that I'd hoped to have more than 4 months run-in with the Jameel Institute before we had our worst global pandemic for 100 years. I mean, it has been a roller coaster ride. The scientific community generally, and Imperial specifically, have responded remarkably to this new threat. And many of the tools and the research which we've been developing for really the last decade were brought to bear. I think in terms of lessons scientifically, there have been many changes. One of the things is just the rapidity of getting research out there. You refer to reports. The traditional way of publishing research is, of course, peer-reviewed publications, but everybody has been putting basically pre-publication material out through preprints, through reports, and that really guided the policy response early on. I think the second one is that if nobody had heard of infectious disease modelling 18 months ago, or somebody hadn't, they certainly have at this point. The role of statistics, data analytics, the fact that everybody knows what an R number, a reproduction number is now, everybody has been tracking incidence curves, case curves, and death so religiously for the last year is great for our discipline in terms of the level of interest we have from people, but it's also indicative of how those methods, which are relatively new, which have been developed in the last really 2 to 3 decades, have shaped our understanding of this pandemic and the responses to it. And it's been a privilege to be part of it. And I should say, whilst I may be the most prominent member of the Jameel Institute and the MRC Centre it contains, I mean, there have been dozens, if at some points, nearly hundreds of us working on it, and really part of a shared endeavour globally. People will be very well aware of the research we've been doing in the UK of Report 9, but we have been supporting the World Health Organization, low and middle income countries as well, working closely in partnership just in recent weeks with colleagues in Brazil who are facing a really devastating second wave of the pandemic now. And one of the things I think the new School of Public Health in White City will enable us to do is in that very hybrid way, host those collaborations better, both interacting with our colleagues day to day in multiple disciplines. Another lesson of the pandemic has been how interdisciplinary and multidisciplinary this research has been, but also reaching out both to the local community and then globally to our partners around the world. So I'm very optimistic about the future, and I would have a particular note of thanks for Community Jameel for backing us both presciently all that time ago, 2 years ago, but in terms of the support, both financial and personal, provided by Mohammed and his family and colleagues throughout the last year.
Thank you, Neil. And that global reach is so important. This is a worldwide pandemic, and as we're seeing, we can work on it in one place and need to bring what we've learned to other places, and that's so appreciated. Murray, you have studied and brought attention to numerous environmental hazards affecting life and children's health. Part of the Mohn Center's flagship research is your SCAMP study, which focuses on children and their use of mobile devices. While we've been locked up, homeschooled, and spending more time on our devices, what are the consequences on cognition and mental health, and what can we learn from this pandemic?
Well, I think we've all been, touched by the lockdowns over the last year, but I think children and their parents, in particular from school closures, have really been affected. And what we've been seeing in our SCAMP study has been that the number of young people who've hit the clinical threshold for anxiety has actually gone from 13% before the pandemic up to 29% during this last year of the pandemic. And for depression, that's actually gone from 14% up to 35%. Now, it's possible these might just be short-term effects, and obviously other things have changed in children's lives as well, and we've seen things like social media and smartphone use going up by 80% over the last year, alongside sleep duration going up by 60%, and physical activity for some children going down, for some going up. So there's been huge changes in lifestyle that have happened. And yes, they might be short term, but if they persist, then actually these could be very worrying figures, because half of adult mental health illness manifests by age 14. And by age 24, that figure is already 75%. So clearly, early life through to adolescence is actually a really critical period for lifelong health. So looking forward, I think the Mohn Centre, due to the generosity of Marit Mohn, has given us the infrastructure to really be able to start thinking about mental health and its interaction with physical health, and really consider whether our response to the pandemic has possibly changed lifelong trajectories for many of our children, particularly thinking about the differential impacts by gender, by ethnicity, by deprivation, because what we're seeing is that the most deprived groups are actually twice as likely to have had that increase in anxiety compared to the most affluent groups. And in terms of ethnicity, it's not an even keel, that we've got children in Chinese ethnic groups who are by far the worst affected in terms of depression and anxiety during the pandemic years, followed by Indian, followed by white children. So it hasn't affected our children in an even way. And it's now what our vision to try and see how we can best equip our children to get back onto that healthier pathway.
That's really, really important, and thank you so much for those insights, because this is something that's obviously a long-term issue that we need to deal with, but also has been made acute and really come to our attention through this crisis. So thank you, Robin. Well, we have been focused on the spread of the infection and learning about our numbers and other things. We know that there are other epidemics of chronic diseases that are harming people's health all the time. And our School of Public Health and your work with the George Institute are committed to changing that, helping with these chronic diseases. What has the pandemic taught us about chronic conditions, and what are you seeing going forward?
Thank you, Alice. Before I respond to that, might I just say it's a real honour and a pleasure to be invited to speak here, particularly with my colleagues, and frankly to be part of the School of Public Health in Imperial College London. It's a great place to be, and we look forward to an opportunity to interact with people in person. We haven't had a chance to do that yet. But to come back to your question about chronic diseases, I think one of the most startling findings for those of us who work in that field have been very much made aware, and the public has become aware, that the greatest risk of death from COVID is amongst those who have pre-existing non-communicable diseases, chronic diseases. So for individuals with chronic kidney disease, we know that the risk of mortality is twice as high. We also know that for individuals who have some of the risk factors for chronic diseases like smoking or obesity, and in particular obesity, the risk of death from COVID is 50% higher. We're seeing this whether it's in women or men. We're seeing this whether it's in high-income countries or low-income countries. And indeed, some of the work that we've now been doing at the George Institute has shown the same relationship for individuals who have influenza and pneumonia. So what does this mean for the long term? Well, clearly we can't continue to think about and operate in disease silos. We have to recognize that infectious diseases and communicable diseases and non-communicable diseases coexist. And that has real implications in terms of prevention. It has real implications in terms of how we need to think about our healthcare systems moving forward.
Thank you very much. It seems that raising awareness of these impacts of chronic conditions will be so important as we look at our own education policies and our ways of getting the public engaged. And this is an opportunity perhaps to make some of those points really clear to people and then help them find the ways to help with their health and these chronic conditions. So thank you. Frank, with a respiratory disease, of course, the air we breathe is critically important. And you and your group have revolutionized our understanding of air pollution, and your London Air Map is so valuable, your Breathe London network. You're bringing that knowledge to the public and also informing government policy. What have you seen during the pandemic? And as a consequence of the pandemic, how can we work for better policies?
Well, thank you for that, Alice. And I'd just like to join my thanks to Robbins for having the opportunity to join Imperial and to be here with colleagues tonight. So I think we all recently learned that COVID-19 has been linked to the deaths of more than 3 million people. I mean, a shocking statistic across the globe. But it's really my role to remind everyone, and especially policymakers, that air pollution contributes to the early death of over 7 million people every year, a truly public health challenge. Now, the solutions-driven research we're undertaking here at Imperial illustrates that the shutdowns introduced as a result of the pandemic led to a decrease in vehicle emissions across many towns and cities. And this especially was true for the pollutant called nitrogen dioxide, the gas that we get from combusting petrol and diesel. But other pollutants such as particulate matter, which really have a marked health effect, didn't change at all, or in some cases actually increased due to their emission sources. And so this really helps us to remind policymakers as they debate and decide on the contents of the new Environment Bill that we need to go way beyond the control of just tailpipe emissions if we're going to meet this challenge that we have to improve air quality, not only in the UK, but clearly across the globe.
That's really interesting and something that should gain a lot of traction and attention now that we've been through this experience, and it's very very clear how important air quality is and our ability to find the right ways to make the air cleaner for everyone. Maybe later we'll come back to some of your studies of air quality around schools, because that ties in with Mireille's work on children and environmental effects. First, I'd like to go to a question from the audience, from our audience. Professor Galadari has asked, given what we have learned from the current pandemic, how would Imperial College School of Public Health work to ensure better prediction and then guide through the research evidence the management of such events better at the global level? Clearly, these are global problems. And I thought, Neil, back to you on that, please.
Yes, an interesting question. So there's different elements to prediction. I mean, when we're faced with an emerging epidemic and emerging infectious disease like SARS-CoV-2 or COVID-19 as it's generally known, then initially one is not trying to predict exactly what the trajectory of the epidemic will be, but characterize the nature of the new threat. And I mean, we were instrumental in generating some of the first estimates of the lethality and transmissibility of this new virus. And those are perhaps the two most important quantities. It's only at that stage, when you've got that level of understanding, that you can then start to think about what their global or local trajectory will be. And we've learned many lessons in this pandemic about how to do it. I mean, both methodological lessons, how to do our job better, but also, and I think this is perhaps more important, about the characteristics of what the global surveillance system needs to look like, and what are the data streams which are most important to get up and running early. And generally, I mean, China did a good job on getting on top of the epidemic in their country early on, but only had the testing capacity, really, we know in retrospect, to really test a small fraction of people infected, namely those who ended up in hospital. And so the biggest challenge in the early months of this pandemic has been, across the world, it still is a challenge in many countries, has been how to scale up testing and get surveillance systems up and running so you can really track the progress of a virus through a population. And I think that's the number one thing we need to be able to address. And it requires an innovative solution, because we can't obviously maintain an enormous testing capacity for viruses all the time, but we need to have a capability, given a new threat, to scale up testing very quickly, to be able to, for instance, test all travellers coming into countries if we ever face this sort of situation again.
There's a related question that's just come in that I'll pose to all of you, but perhaps first to Neil, that relates to what you've just said. What new capabilities, this is from alumnus Mike Pegler, what new capabilities will be enabled by technology? For example, advanced analytics, artificial intelligence, in the new School of Public Health for both learning and research. And we might talk a bit about both, but I know all of you are engaged in that. Neil?
So undoubtedly, I mean, what we're seeing is a convergence of what were previously rather disparate disciplines. For instance, computer science, statistics, mathematical modeling, genetics, coming together under the remit of what you could call more generally data science or systems biology. And it has been fundamental to what we've been doing through the last year, and will be fundamental going forward. So we don't really distinguish between traditional statistical and epidemiological analysis or applying machine learning methods to genomic data. We did a lot on the emergence of the Kent variant, for instance. I mean, it has to be, these are increasingly powerful tools we need to pull together to answer any one question. So that's on the analytics side. I think the other important thing is our contribution to, let's say, product development. And that Imperial has been in the lead of developing vaccines and other technologies throughout this epidemic, and people within the School of Public Health have added value to that by providing that kind of analytical population insight. And so there have been remarkable breakthroughs in the last year. Particularly, I would highlight, messenger RNA-based vaccines, the Pfizer and Moderna vaccines, which will be the face of the future of vaccines. But overall, the vaccine story has been remarkable, and we have been heavily involved in both advising many of those development programs, but also modeling how those vaccines are best rolled out in populations to maximize their impact.
Frank and others, Frank, your technology revolutionizes your network and your ability to monitor air quality, and even to have kids carrying around detectors. And Murray and Robin, perhaps you can comment on this too, because it's an exciting time.
Yes, thank you, Alice. I mean, from an air pollution point of view, before we can do anything, we need to know what the pollution level is, because that underpins the response that's needed. So traditionally, measuring pollution accurately has been a very expensive thing to do. We have a lot of regulatory monitors. They're very expensive across London. And what we've been able to do during lockdown and as we moved to Imperial was to get the support of the GLA and Bloomberg Philanthropies to actually set up a sister network, our Breathe London network, which consists of lower cost sensors, which we're able to line up mathematically with our more accurate ones, so that we can, as it were, develop the third technology. And this allows us to be able to put these sensors into hospitals, into schools, into community groups, and then suddenly everybody has got access to information where they work and where they live. So technology is really, really helping us there. And then in the second area, it's really the distribution of that knowledge. So that's through the development of the apps that you mentioned at the beginning, where we can provide Londoners with a piece of tech which allows them to plan their journeys so that they avoid the most polluting areas, the most polluting times of day. And this is really, really helpful to those that are out there whose bodies respond to that pollution challenge, such as many of the people with respiratory diseases that we're working with closely.
I wonder if any of you want to pick that up, Murray, Robin.
Perhaps if I could take a different approach to this, and this is more coming back to the idea of what has been the implications for health systems. And we've seen a lot of people have not been able to receive the care that they would have normally received because the health system really focused on the management of COVID. So that's really, we really need to think about what does that mean for the future. And it was very interesting listening to colleagues from Rwanda recently, where they have a system where the health care goes to the people. People don't go to health care, and they use technology, mobile health processes to enable people to ensure that they have access to health care. They've found through COVID that there has been very little disruption to healthcare for all of those other conditions. We need to think about what does that mean for places like the UK. And perhaps to use another example from some of our colleagues that our colleagues in obstetrics and gynecology have used is the whole issue of the approach to telemedicine and medical abortions. It's been quite dramatic in this country how it's been possible to continue to provide abortions for women much more safely than previously because of the opportunity to use telemedicine. So slightly different take on that, really important lessons for us to learn.
And we've been using technology for children's health as well by developing new apps where we've been collecting vast amounts of data on children's digital environment usage and also on their mental health. And actually we've then been using machine learning methods and artificial intelligence methods to actually analyze those data and be able to predict which children are likely to have a low mood based on what they're actually doing, and then be able to nudge them to go and do something that might improve that mood. And there are lots of apps out there that are self-help kind of mental health apps already that do that kind of thing. But they're not evidence-based. They're not actually using evidence and machine learning techniques to really understand the individual and what their needs are. And through what we're doing, we're actually starting to be able to see that we might be able to create a sort of semi-intervention tool on the pathway before children actually get to what is a clinical threshold of mental health illness, and actually be able to start equipping children with mental health competence, with skills that will enable them to change their own pathway so that they don't end up, with full-blown clinical illness.
That's so important. I think young people are often more readily engaged with an app than with an adult, at least at some level. I've had a couple of questions about collaboration and collaboration with other universities, with NHS. Alexis Durrett St. James writes, how will Imperial's new public health school foster innovation, and will it collaborate with other universities in these endeavors? Anyone want to take that one up?
I mean, I would say we are hugely collaborative right now, and that's just been heightened by the pandemic, if anything. I mean, the response both within the country and globally has been one of the scientific community ceasing to compete with each other in different institutions, but working together to tackle the challenge. And often, I mean, the way UK policy has been formulated often is by deliberately getting multiple views of the same challenge, and then we come together, understand the differences. And so, you know, my friend and colleague, John Edmonds at London School of Hygiene and Tropical Medicine, I'm on a WhatsApp group with him the whole time. And it's those partnerships which have been critical. So we work both across London, across the country, and across the globe.
Can anyone pick up on the innovation question? You're going to be located with our iHub, where our incubators are, our new scale space building just across the way to grow enterprises. There's a lot of opportunity engagement there. And then next I'll move to engagement with the community. But anything with the intellectual property side?
I've got a great example, Alice. Soon after I arrived at Imperial, I learned about the Tire Collective, which you will know all about. There's a group of entrepreneurial students who are developing a device to capture tire tread particles before they actually hit the road surface and end up going into the water channels or eventually in the ambient air. And this is just a fantastic approach to try and deal with what I see as being the next big urban challenge, and that's non-tailpipe exhaust.
That's a great example, and when we're finally all back together, you'll be just right across the way from the very people from our business school who can help you with ideas from research that you'd like to spin out or scale up. And so it's a very exciting ecosystem the school is moving into. There have also been a couple of questions about whether the building will allow engagement with the community. And I think that this is very important since in White City, we've taken a very proactive approach with the invention rooms, with our hack spaces, inviting the community in, getting especially the youth from this deprived community engaged in maker spaces and maker challenges. And I might look to Deborah if she is able to help us think about this, because we collaborate very much with the GP clinics. We create the new GPs, we educate the new GPs, and we're very eager to make sure we're engaging with the White City community as we move in. So Deborah?
Yes, absolutely, because public health is all about populations and communities. Some of that, as we've been hearing, is global, but particularly in White City, we've got populations right on our doorstep. And I've spent a lot of time over the past couple of years and will be for the next couple of years working on the design of that building. And the whole philosophy is that people can come in, particularly on the ground floor space. It'll be open. We've got community engagement space on the third floor. I think we've got our teaching space in the first couple of floors, community engagement space on the third floor, so that we can bring in community, because we work very closely. We've got the Patient Experience Research Centre led by Helen Ward, where we work very closely getting patient input, collaboration with our research projects. And I would hope that in White City, we can do so much more of that, building on what has been going on with the work with school children and so on. So absolutely, it's absolutely fundamental. And because we're on Wood Lane, actually, we're one of the first buildings that public will come to. So making that welcoming space is absolutely part of the ambition.
And Frank and Murray, I know you're engaged very much with the young people in the schools in the area. I don't know if you'd like to comment on the engagement with the community with White City.
Murray, would you like to go first?
Yeah, I mean, I think it's absolutely the cornerstone of the Mohn Centre to ensure that what we're doing is translational science, and that we're starting from the community level and what the community needs are. And working with school children is what we've been doing for many, many years, but now bringing it to White City is something that is actually at the forefront of what we are planning. And I think the idea really is to hear from local children, what are the things that, you know, affect them, what do they want to know about, what do they believe will make an improved future and improved health for them, and really try to work with them to make that happen. So not just engaging them in terms of telling them our results or involving them in our research simply as participants, but actually involving them to co-design all the research that we do, come up with the questions that are important. Because if we do that, then by the time we get to results, the children will actually be interested in what it is that we have found, and actually we will then be able to translate that to actually improving people's lives.
And I think, Alice, the audience may remember that you introduced me as the Humphrey Badcock Chair in Community Health and Policy. And that's one of the main reasons that I actually wanted to move to White City, because of Imperial's track record of setting up that community hub and the underpinning of future research projects, which we are now planning. And one of the first things my team and I did when we arrived here was to actually sit down and write a research application which would allow us to go out and interact with the community. We have a track record of researching ambient air quality, i.e. the air that we breathe outside buildings and homes. But actually the next big challenge before us is what we're breathing inside our buildings and homes. And so we've submitted an application called Well Home, which really focuses in on that question, utilizing the great community that we have here at White City.
Alice, if I could add to that, if I could add to that, the George Institute, as well as having that particular focus on chronic disease, one of the things we're very keen to do with the School of Public Health, and indeed with colleagues across medicine, but more broadly, is to look at the development of a Centre for Women's Health. And I think the approach that Maire's outlined with respect to the Child Health Centre is very much one that we would also like to embrace with the Women's Health Centre. What are the issues? What are the needs? Not only with respect to maternal and reproductive health, but what are the needs with respect to their leading causes of death and disability? So yes, we are very keen to be involved, and I think encourage those who are interested in working with us on establishing a Centre for Women's Health to reach out to us.
That is a very high priority for the school. Yes, Marie?
I think that fits very nicely all together, because what we're actually saying is that maternal health, women's health, that's parental health, children's health, and environmental health all come together. I mean, we're all working together to, achieve the goal of lifelong improved health for our communities, particularly our local communities in White City.
Absolutely. Well said. Thank you. There are a couple of related questions on lack of trust, public trust, and I'll read both of them. And then Councillor Ben Coleman asked, the vaccine program has highlighted a lack of trust and confidence in the NHS by many from a BAME background in place of health inequalities. Isn't it time to talk more openly about the impact of racism and poverty on health and perceptions of public services? Matt Bell asks, what can be done to restore public confidence in experts in science, amplifying the light of scientific insights and marginalizing scaremongering based on imagined fears? So perhaps, I know, Marie, I think you've been engaged a bit with the vaccine uptake and with the public. I just hand it over to you all.
Shall I make a start on that? Because one of the things you have to do is to understand the nature of the problem. And with the REACT studies, where I'm one of many people working on that, we have collected quite a lot of data on vaccine uptake and so on. Although that's not the complete solution to addressing it, it certainly gives us really good information about, well, first of all, who's getting the disease, but secondly, then now we're getting information rolling through on vaccines. We're getting good data on that. I mean, in terms of trust in science, I mean, I think, I turn on the radio every morning and I hear one or other of my colleagues, if it's not the people on this panel, it's Paul Elliott or Steve Riley or others in the college. And I mean, it'll be interesting to study what effects that's had, but I'd have thought for some groups that trust will have gone up. Now, where there's deep-rooted issues of trust, and I think some of those that you've talked about in some of the sort of more minoritized communities won't be quite so easily assuaged. So maybe I'll hand over to my colleagues there. But
maybe I can add something. So I think there is a real issue here. If you look at vaccine uptake, then it has been incredibly high within the majority white community, but there have been, I mean, challenging lower uptakes in some, and I don't particularly like the BME term, but within some minority groups, not all. And I think we do need to address the issue of diversity. If we look at this panel, we don't have minority representation on it, but it is something Imperial takes very seriously, and we do have an action plan to address it. So I think one of the ways of engendering wider trust in experts is for people to see people like themselves on such panels. And whilst mea culpa, I am a privileged white male, it is something across the college we are doing our best to address really quite urgently. And we could have had another panel which looked a little different.
Absolutely, Neil, and let me just support that helping with schools all the way down to primary schools, as well as our new math school, as well as the invention rooms. We're very much looking to diversify our student body as well as our staff, and we will be working diligently on that in the next decade. We're actually down to the lightning round because I only have a few minutes left. Martin Houston had asked, when we look back on these years in this pandemic, what have we learned that we will be able to jumpstart work on other human conditions, in particular on child health? So perhaps a lightning round, and then I'll close.
I mean, maybe I'll quickly start and just say, I think if you look at how quickly science and public health have developed just in the last year, I think it is a paradigm shift in what is potentially achievable if there is enough urgency behind a problem. It's also led to revolutions in how we think about regulatory frameworks for new products as well. And I think that it's too early to say exactly how that will translate into other health areas, but I'm very optimistic that it will translate to much faster developments to improve public health generally.
I mean, one of the things I'm passionate about is that we train the future public health leaders, because actually they're the ones that are going to have to deal with future pandemics and future issues of children and everyone else. And I'm really proud. We already had a global masters in public health set up that's online to make our teaching much more widely accessible to those who really need it in places they can study. And that meant that we could pivot to having some of our more conventional teaching in online mode to high quality really quickly. And so one of the takeaways is how we can then use that to carry on training that next future generation, for which we need good technological investment, ironically enough, going back to one of the previous questions. So, I think we now have an even greater need than when we planned the building. So if anyone's looking to help us with that, that would be brilliant.
Thank you, Deborah. And that's actually a good point for me to sum up, because we are out of time, I'm afraid, and there are many other questions we can try to answer in follow-up with everyone. But I'd like to thank our whole panel and Deborah for a marvelous conversation, and for all your dedication to making the community healthier. We're fortunate to have such world-leading scientists bringing their intellect to bear on the health problems we face. I also thank Neil Alford and our talented estates team who are bringing superb management of the building project, and Deborah, your outstanding leadership on the School of Public Health. I also want to thank our friends and generous supporters for your confidence in us. Together, we really are making a difference in the world. Our campaign has been tremendously successful so far, but there is much more to do, as you can tell from this brief conversation. And our Premier School of Public Health is an integral part of one of the most collaborative, multidisciplinary, and innovative universities in the world. It's a new home in the White City campus, and this will amplify our collaborations, our innovation, and our teaching and research across disciplines. As you can see, we are bringing a new and different approach to public health. We have a holistic and multidisciplinary focus on prevention and intervention. We're spanning the continuum between physical and mental health. We're bringing the power of data and new technology, as we discussed, to understand population health and to bring innovations to those who need them. We will bring what we learn about global health into our community and learn from our community to be more effective globally. So we hope that more of you will join us in this important and timely mission and help us drive forward the remainder of our campaign for the School of Public Health. Thank you again for joining us today.